Hello, today we'll be talking about the fundus of the eye. Now, if you're a medical student or even a physician, you've probably heard of fundus before. And you've never really understood, so what's the fundus and why don't we refer to it as the retina? So today this will be our topic. Let's start off with the eye laws. So we're going to take a basic understanding of what's the fundus and see the anatomical landmarks which are important to see. So we'll see the normal fundus and then we'll talk about some pathological diseases in the following videos. And in this video we'll also talk about the tools that we use to see the retina and we'll go quickly over them. So let's get started. So what exactly is the fundus? So let's talk about the fundus quickly. So it's basically a clinical term, okay? We use an ophthalmoscope. This ophthalmoscope is a device that we use to examine the retina. And while examining the retina, we are looking at the optic disc. So you may wonder what's the optic disc. You've probably heard of the optic nerve before. So the first part of the optic nerve, let's say the origin of the optic nerve, is called the optic disc head, okay? And it could also be called the optic nerve head, also referred to as the optic disc. So the optic disc is the first part of the optic nerve which we see when using an ophthalmoscope. Now, we have three layers over here, if you can see. First layer we have is the retina, behind it is the choroid, and the outermost layer is the sclera, okay? It's very important to know that the retina is a transparent layer. So behind the retina, we could see the choroid because the retina is a transparent layer, okay? And we'll talk more about that in a second. And finally, we have the vitreous. So the vitreous is found in front of the retina and it's a gel-like substance, okay? It maintains the shape of the eye and it's also transparent. So anything affecting the transparency of the vitreous will obstruct our view and we will not be able to see the retina. So a fundus helps us to say that the vitreous is clear. It also helps us to say that the retina has no pathology. So any pathology affecting the transparency of the retina, we will not see the underlying choroid. And finally, we look at the optic nerve head, also known as the optic disc, to see that it's completely fine, okay? Let's move on quickly to some methods to examine the fundus. So we have, first of all, but wait, before we talk about it, we have some examination before the examination, okay? So we've always seen pictures of the eye in 2D and you never got to grasp it. So if I go back, I don't know if it's found here. Okay, so this is the iris and this is the iris. So this picture is never complete in our head, you know, because it's a cross section after all. So sometimes it's not complete in our head, but if we move on to this picture, so let me explain it quickly. So this over here is the iris, yeah? The one I'm drawing a line from. So the iris, when exposed to light, it constricts. And this constriction, we will not be able to see the fundus clearly of the eye. So in order to see clearly, we use a dilator eye drops, also known as tropicamide. So by applying tropicamide to the eye, we have a dilated pupil. Okay, so you can think of the iris as a doorway. So this doorway is very small, okay? And we have to dilate it, open the doorway in order to see the underlying fundus. So as you can see, this is really dilated. So when we examine it, we will be able to get a clear view. This small pupil does not allow us to see clearly, okay? Let's move on. So the first method we have is a direct ophthalmoscope. Now it gives a magnified clear image of the fundus, okay? As you can see, the physician sits close to the patient and examines her fundus down here, okay? And it could be found in non-ophthalmologist clinic. This could also be found in the neurologist clinic to see if there's a brain tumor causing elevation in the intracranial tension. Now, this would lead to edema in the optic disc, and this is not our topic of today, but the main key point is that some systemic diseases cause effects in the fundus, and you could see them. Moving on to the indirect ophthalmoscope, This is the one found in the ophthalmologist clinic. They use a lens, as you can see this lens over here, and it gives a better view. It shows the central and peripheral retina, but it's not as magnified as the last one. And finally, this is the slit lamp biomicroscopy. So let's go on to the fundus. This is the main topic of the video. But before that, we have to explain something quickly. So we know the optic nerve, right? And we explain the optic disc, okay? So quickly taking a look, this is the optic nerve, the one over here that's written in a very bad handwriting. And if you take a look at this part, okay, the one I'm trying to draw currently, this is the part that we see. This is the optic disc, okay? This is the one that we view with our eye, okay? So it's called the optic disc. Now it's very important, if we divide the eye into nasal parts and temporal parts, and nasal parts and temporal part, now the optic nerve itself exists from the nasal part of the eye. Now, why is this important? Because when we look, you have to tell is this the right side I'm looking at, or is this the left side I'm looking at? And how we tell is based on the position of the optic disc. Okay, let's take a look at this picture quickly. Here, look at the right side first. We have the optic nerve, and it's exiting from the nasal side. Okay, and here we have the extraocular muscle hiding it. And this is the right eye. Okay, and you have the nerve exiting from the nasal part. Okay, let's take a look at the fundus. So let's start off with the right eye. This is the view of the fundus. I'll go through some stuff quickly. Okay, so this is the optic disc, and it's found on the right side of the picture. So this is the right eye. Okay, it's easier to understand it like that, and then you could start adding some stuff. So this is the left eye, and the optic disc is found on the left side. So this means that this is the left eye, okay? And you have to keep in mind that this is the nasal side that I'm trying to highlight over here. So this is the nasal side. So if we go to this side, okay, the one I'm drawing, so this is the temporal side, okay? So this is important to keep in mind, and once you know how to differentiate the right eye from the left eye by using the optic disc, this is an important step. Okay, so I've previously mentioned that the retina is a transparent layer. So you may ask yourself, why does it appear red? So the choroid contains blood vessels, so it gives a red color to the choroid, and the choroid is the vascular layer of the retina. Okay, so if we look behind the retina, we'll see a red color, and this red color is the choroid of the eye. Okay, now let's go on to the structure. So here's the picture. I'll go through every part quickly. This over here is the optic disc. Okay, the one I'll go over right now. This is the optic disc that we have. Okay. And inside the optic disc, you see what's called the optic cup. Now, moving on, we have vessels arising, okay? Now, we have a retinal artery and a retinal vein. So, how can you differentiate between them? So, the retinal vein of the eye is larger than the retinal artery, okay? And it has a darker color, in contrast to the retinal artery, which is usually smaller than the retinal vein, and it has a brighter color. Okay, now we'll go over it in a second, but I want you to notice that the retinal vessels means vein and artery, they form what's called as the vascular arcade, and let's go over it right now. Okay, 1 second. Okay, so look up here, we have the upper vascular arcade, okay? And we have the lower vascular arcade down there, okay? These are formed by the retinal vessels. So why are they important? Because the part over here between the upper vascular arcade and the lower vascular arcade is known as the central retina. So why is the central retina important? The central retina, it's rich in photoreceptors known as cones, We have cones and rods. Central retina is rich in cones. And to simplify things and not go into details, the cones are responsible for forming the visual acuity and the color vision of the eye. And whenever we say this patient has 20/20 vision or 6 out of 6, it usually refers to the visual acuity. So this part, the visual acuity, is the part responsible for giving us the perfect visual acuity that we have, is in the central retina, and especially the fovea. But let's wait a second before we go into this detail, okay? So we have the central retina, and outside of this view, we have a peripheral retina. The peripheral retina doesn't form the visual acuity, but it's also important because it's responsible for the peripheral field of our eye, detects light, and detects if there's any motion. So, you know, whenever you're sitting and then there's maybe a small insect moving and you notice it. Now, the part responsible for that is the peripheral retina, okay? And it notices the delicate movement. Okay, finally, we have the macula of the eye and the fovea, okay? So the macula means a pigmented spot, okay? And the fovea, which is inside the macula, is called fovea centralis. This part is responsible for it has the highest visual acuity and it forms the visual acuity of the eye. Now this part is very important and extremely important because if we have a disease in the peripheral retina and this disease is spreading, so let's just say diabetic retinopathy forming some new vessels, and we don't want anything to come near this fovea because its affection would lead to the patient losing his vision and the visual acuity would be reduced, causing problems in the macula. So we would call it diabetic maculopathy. This affects the visual acuity, and this is the most common cause of changes in the visual acuity in the diabetics. So it's very important to know that. Now, once we've gone over the structure, take a second to memorize it. Now, you can pause the video and test yourself by going through the labels quickly. Okay, so here are the answers. If you got them all correct, congratulations, you've understood the basic anatomical landmarks of the fundus and you've taken a quick idea of the fundus. Now, the following videos will be explaining pathologies and the pathophysiologies of some diseases such as the diabetic retinopathy, hypertension retinopathy, and more diseases. So follow on with the playlist to understand the pathophysiology behind the diseases affecting the eye. Thank you for watching.